a local nonprofit, is committed to enhancing the lives of those affected by advancing age or illness. Through their comprehensive system of healthcare choices, they deliver expert care and heartfelt support to guide the communities we serve during the aging and end-of-life journey. The story is coming up next on Polk Place. Welcome to Polk Place. I'm your host, Lauren Lingell. Joining me in studio, we have Dr. Andrea Miller. She's the Regional Medical Director of Palliative Care for Chapters Health System. Dr. Miller, it is so nice to have you back again. We had a great chat last time, and I expect nothing less this time. So
I'm very excited
no
to
pressure.
be back. No pressure, right. I appreciate that.
So palliative care has had some exciting things happening in recent months. You all have just had a big grand opening,
Yes.
I'm told. So tell me a little bit about that and
So
what that facility is.
The grand opening that we're talking about is actually for our clinic, our palliative care outpatient clinic, which is here in Bartow. It is in the medical building right next to the hospital here. And it is open Tuesday mornings, 8 to 12. We've been open actually since around November.
We're talking about palliative care, so let's slow down maybe and talk a little bit about that for those who might not know exactly what it is.
Sure. Palliative care is unfortunately a very long word to really describe quality of life support. So what we do is we actually come alongside the patient and their primary care doctors to provide an extra layer of support for them so that our goal is to focus on how they can live the best life they can for as long as they can. So whereas their primary care doctor is making sure they're taking care of their basic medical needs like high blood pressure and diabetes, things like that, we are really focused on what is their functional level, what is it that they are doing to improve that, what things are important for them to accomplish in their life, and how can we help them, how can we focus on those things and make sure those things get done.
So let's say someone has an illness and they're being treated for it, in addition to maybe some other chronic issues, maybe like high blood pressure or hypertension or something like that, and then they develop a new symptom. That's kind of where you come in and you say, okay, you're on all these medications, and this new symptom could be a result of this one, so maybe you want to have this conversation with your doctor, and either another medication may be available or let's take one away.
Right, and you mentioned take one away, and it's really interesting that you should, because that is one of the things that we often will do is talk to people about all the different medicines they're taking and why they're taking it. And not surprisingly, if most people, if they went in their medicine cabinet and looked, they would find that they've got a lot of medicine in there, much of which they haven't used in years. And if they have a problem, they think, oh, I'll just take some more of this or some of that. Well, every medicine can have side effects. And so what we do find is very often when people are on over 7 medicines, for example, that they will tend to have at least one major side effect related to the interaction between those medicines. So a lot of what we do is kind of slow everything down and say, let's get back. Tell me what you do every day. Tell me what's important to you every day. And tell me what you think has worked for you before.
So you guys are like the listeners. You come in and you're like, we want to know everything. Take as much time as you need.
Exactly. And you know, I've been a primary care doctor. I did that for quite a number of years and absolutely loved it. But I had to see an awful lot of patients in order to take care of them all. And so I didn't have the luxury of the time that I have now to be able to spend with them, to be able to make sure that they got what they needed.
The thing about medication that you mentioned is so funny, that they all kind of, you know, interact, or you have medication you don't use, or what have you. my mother probably, she does the same thing with vitamins though. She takes a trip to the health food store. She's got like 10 different types of vitamins, and they all do different things or different supplements that counteract the other supplement. And it's like, Mom, maybe you should just stick to a multivitamin, you know?
Or talk to somebody about them, because there are a lot of supplements that interact with medications.
Absolutely.
And can interfere with the way the medicine is supposed to work. So that's one of the things we always ask people, is we actually ask them to bring in everything that they put in their mouth that's not food, so that we can look at all of them and make sure that we all understand what they're taking.
So that's just one piece, looking at all the pharmaceuticals involved. But the other thing that you talked about was what they want to do with their life and what they're able to do with their life, as far as, I'm assuming, activity level and function. And you have a hand in that too as well.
We do, and that's really one of the major things we do that is a little bit different than a typical doctor's office. Not because they don't want to, but again, they have to focus on the things that brought the person in. So our focus gets to include what they're doing in their life and what things are important for them. So it's really critical that we consider whether walking is more important to somebody, or whether being more alert is more important. There are times when all medicines have a burden versus benefit. And there are times when some treatments are going to affect you, either physically or mentally.
But you make an excellent point, and it's something that as I get older, I'm learning. It's so important to be your own advocate, your own healthcare advocate, and making sure that whether it's bringing that list and asserting yourself that way, or asking those questions that maybe, you know, in the short period of time that a primary care physician has to see you, maybe they didn't get to, or, you know, unintentionally.
Well, or they need to focus. You came in with a specific problem, and their primary responsibility is to make sure that they're addressing the thing that brought you in. And then making sure that if there's something dangerous to you that they notice, that they don't let you walk out without addressing that too. And that's a pretty full plate to do both of those things. So adding on to that gets a little bit more difficult. And everyone wants to try to help people do the best they can. And we all are trying to get that information to and from each other. But you brought up a really good point about being your own advocate. A big difference between when I practiced in the 80s and now is doctors were the owners of medical information in the 80s. If you wanted to know something, you went and asked your doctor. That was really the easiest way to get it, and it was very difficult to get it any other way. You could go to a public library and you could try to research it yourself, but you mostly didn't have access to the information. Now, we actually have too much information.
I agree completely.
Because not all of it is true. You may not know how to interpret that information. You know, if you talk to any scientist about how to read a controlled study, there's a lot that goes into that. And so the conclusion that is reached on the news, you've seen them. One day it'll say, don't ever drink milk because it'll kill you. And the next day it'll say, milk is the best food. And each one of them cites an authority that says this is absolutely true. So you do need somebody to help you interpret it, which is your healthcare provider, whether that's a doctor, nurse practitioner, PA, whoever that is. They are really valuable to help you interpret what is meant by something. And it's really a good idea. If you want to do research, that's fine. But don't make major changes in your medical care without checking.
And absolutely, if the complexity of your care increases, then, you know, palliative care may be a really great solution for that.
Absolutely. And you know, Chapters, we have a lot of different services that we offer. So the palliative care is the medical provider side of complicated patients who have chronic conditions. In addition to that, Chapters also has home health services and hospice services that help with people who are either need relatively short-term help with their medical care, which is usually a home health type service, or people who are getting close to the end of their life, which is what the hospice services do.
So as far as what you do and what the services the clinic provides for palliative care, is that something that you're going out into their homes and working with them on? Is something they're coming only to the clinic? Or really I'm asking is, how does somebody get in contact with you, and how do you make that relationship?
So several things. That's a really great question. So the hospitals is where we started our palliative care program, like most places in the country. Why is that? It's because that's where the acute need is. That's where people are wondering what they're going to do next and really interested in their health. So we started here in these 3 counties, Polk, Hardy, and Highlands counties, almost 3 years ago. We started providing some services in hospitals. At this point, we provide services at Winter Haven Hospital, at Advent Health Sebring, Advent Health Lake Placid, Bartow Memorial Hospital recently, or will be within the next week or so. We've just been credentialed there. So, and limited service at Lakeland. So the hospital services, people get to see us in the hospital by, if you're in a hospital that has a palliative service, basically just asking for it. The doctors and case managers are well aware, and they're usually very happy to have us involved. So if you have a complicated problem and you happen to be in a hospital, or somebody you love happens to be in a hospital, that's a good place to go. Then we also have the outpatient clinics. Now, we love the outpatient clinics because most of our lives are not spent in hospitals, fortunately. We don't want them to be.
Right.
So we need to be able to provide that support to people when they're not in a hospital, and when they can make their decisions when they're in a healthier situation. And so we've been providing those services, like I said, since around November of this year. And right now we're just in Bartow, but we have people traveling as far from Lake Placid to see us there. So we'll see anyone that is willing to make that journey, we are more than happy to see. In addition to that, we plan before the end of the year to be working in people's homes and also in nursing homes. But that's still under development, so I can't say too much more about it now.
Okay, well, fantastic. We're out of time, but I would love to have you back, and I would love if you could share with us a success story.
Would love to do that.
When you come back. I love nothing more than to hear about how it's working and benefiting our community. So thank you so much for being here, Dr. Miller.
Thank you, I appreciate it.
The Chapters Health Palliative Care Clinic provides welcome assistance for patients with serious illnesses and/or complex diseases in an outpatient setting. Palliative care focuses on providing relief from the symptoms, pain, and stress of a serious illness. The goal is to improve the quality of life for patients and their families. Palliative care is provided by our own specialty-trained team of doctors, nurse practitioners, social workers, and chaplains. They work together with community physicians to offer an additional layer of support for patients and their family members. For more information, you can give them a call at 813-871-8200 or look them up on the web at www.chaptershealth.org.